chose this program because of many things. The didactics are fantastic. The faculty members are also fantastic. From my rotation here, I got a very personal feeling about this program and just knew that it was kind of where I needed to be.
I felt at home here. I rotated here as a fourth-year medical student, and I walked into the hospital and I felt very welcomed and appreciated.
We have really great relationships with the faculty here. Every single one of them is easy to talk to, friendly, never minds if we ask them questions.
It's sort of a community hospital that's becoming more academic. We have a lot of resources like an academic center, but because of the area we're in, it feels more like a community hospital. We do a lot of the procedures ourselves.
We tend to do 4-week blocks, and we rotate between emergency medicine, we do critical care medicine, we do trauma, we do anesthesia, and these are all in first year, by the way, so it sort of expands from there.
As an intern, as soon as you start, you own every single patient, so you get to do all your procedures, you get to do all of the notes, everything, all the lab orders, which is scary for the first time, but we are doctors, you know what I mean? So it's great that you get that autonomy and respect as a doctor.
We have pediatric trained ER doctors that when you're on shift with them, you work with them, you see every kid, and you get to see how kids present versus adults, so that when you're out maybe in a community hospital and other ER adult docs are not comfortable with that kid coming in, you're like, oh, I'm comfortable with this. I've seen this before.
I just started my EMS rotation, and basically about 4 days a week I go in to Western Berks Ambulance, and I get to ride along with a crew for an entire day. And I think it's great to see a different perspective for those that have never done anything related to EMT or paramedics. You get to figure out exactly what they experience in the external environment prior to bringing that patient in.
The program is designed to give you exposure to those different scenarios you might come across. And so we deliver babies on our labor and delivery. We run traumas during our trauma rotation and put in chest tubes. We intubate people in anesthesia. These are all skills that are essential to be an emergency provider.
Reading Hospital is the single busiest ER in Pennsylvania. I think it ranks within the top 10 of the entire country. So I chose it mostly for the patient volume, but also the patient population that it serves.
I think this hospital is beautiful. I've thought that since day one. As you walk around, you have this warm feeling as you go throughout the hospital, especially the healing garden. If you get a chance to see it, it's absolutely beautiful.
I think we have a top-notch facility. Our trauma bay, I remember from when I was interviewing, when they showed us the trauma bay, it was this big area. It was nice and open. It was very well thought out how the setup was. The CAT scanner was right behind where the attending stands. The trauma bays are set up so that the trauma attending can see everything all at once. And that kind of just spreads beyond just the trauma bay. It's the entire department that was well thought out and planned.
My favorite part about residency here is feeling like I'm getting smarter every day, learning a lot of medicine, but I also get to have a life outside of medicine. So we work really hard here while we're on shift, while we're at didactics. We're learning new things, we're getting better every day, but I get to go home afterwards to my family and have a life outside of this. I could see my friends, I could see my parents, significant other, and really get to do things I like outside of the hospital, like sports and outdoor activities.
It is a long and hard journey to get to the place where you are, and you put a lot of hard work into this next step. So follow your heart and feel what program is right for you. But I would say, Reading Hospital has been really fantastic for us, and so I would strongly advocate for it.